So as a clinician, you spend most of your time managing patients for causes and consequences of inflammation. Talked about that one, it's relevant. So cause of inflammation, causes of inflammation. Remember that from the definition we said inflammation is the response to the damaged tissue that initiates cellular and vascular events that are designed to initiate or to remove the particular cause or infectious agent and initiate repair. So from the definition, you can tell that inflammation cause of inflammation. Okay, cause of inflammation. So from there, you said get rid of the cause of cell injury. From the definition, you can see that get rid of the consequences of such injury. Okay, makes a way for the tissue repair. We talked about what and may lead to harmful effects. Okay, so now anything that ends with itis after an organ denotes inflammation. So gallbladder cholestasis, meningitis, liver hepatitis, vein-form appendix appendicitis, dermatitis. So without inflammation, infections would go unchecked. That's correct, because if we don't have inflammation, like we said, that inflammation has been designed to remove the cellular debris or the cause of infection, or sorry, the cause of any injury. That's the purpose of inflammation. Now, if we don't have inflammation, it means that the infections would go without being checked. Wounds would not heal, because we said that upon the injury to the vasculature or the blood vessel, that will tell the platelets to start releasing the thrombus agents. No, thrombus-promoting agents that will lead to formation of thrombus, and that will, when we talk about that, particularly in hemodynamic disorders tomorrow. Injured tissue might remain in permanently festering sores, meaning because there will be inflammation, so forever. Okay. Cells and molecules of defense include phagocytic leukocytes, antibodies, and complement proteins. We talked about this. We've been talking about them almost every day. Most of these cells are in resting state in secretion from where they can be recruited rapidly to inside in the body. I was talking about that. Like these cells, you find them in the blood, and they can be recruited to anywhere in the body where there is any injury. Some of these cells reside as sentinels in the tissue looking out for threats. I talked about that. So that's why I told you, like, this explanation has summarized everything, the first explanation. So if you just watch that video again, it will make sense. So the process of inflammation delivers these secreted cells and proteins to tissues. I talked about how the cells move to their tissue plate where the injurious agent is. It activates the recruited and resident cells as well as soluble molecules. The aim is to get rid of the harmful or unwanted substance. So it's there in the definition. We said this too, designed to remove the cause or the agent and also repair. That's what we said, and initiate repair. So what are the causes of inflammation? We've got microbial agents where we have bacteria, viruses, fungi, parasites. We've got physical agents, trauma. That's trauma. So trauma is also one of the causes of inflammation. Heat, cold, radiation, all these can lead to inflammation, and it responds in the same way, but you find that maybe the antibodies, that is inflammation. Chemical agents, acids, foreign materials, exogenous versus endogenous state. Sutures, sprinkles, cholesterols, the LDL. Remember the LDL, low dense lipoprotein. Those ones are part of the cholesterols, and urate crystals. Urate crystals, these are just products of protein digestion. So foreign materials, tissue necrosis. Necrosis can also lead to inflammation. If, for example, there is ischemic necrosis. In ischemic necrosis, what it means is that there is ischemia, meaning that there is diminished blood supply. There is hypoperfusion, diminished blood supply. So when that happens, the body will feel like something is missing in the blood or in the vicinity. So it will activate the inflammatory response, and then the same vascular events that we talked about and the cellular events will occur. so that it can be removed. Now remember we said the white blood cells will be recruited towards where the tissue is, the injury is. When they go there, they will cause phagocytosis and they kill that same very microbial agents. So tissue necrosis is also one of the causes. Immune reaction, hypersensitivity, autoimmune reactions, all those causing inflammation. Components of inflammation. So what are the components of inflammation? Number one, we've got cells. We've got also mediators of inflammation. So we've got cells like leukocytes. Examples of leukocytes, we know this. We were doing them last time in the neurology. So we have got neutrophils, lymphocytes, monocytes, basophils, mast cells, and macrophages. They can't ask you the components of inflammation because they know you can answer this one. Platelets, I talked about them, yeah, in the last video. Plasma proteins, I mentioned them, remember? Plasma proteins, you have got what you call the complement system, which are very important in inflammation. They kill, they phagocytose, they make the cell to be lyized or to be lysed, meaning that the cells will, how can I say it? They increase the cell permeability in the same infectious agent, triggering lysis. They will cause increase. There was influx of water or the flowing of water into the cell. The bacteria, for example, and then the bacteria will paste. It will lyse to undergo lysis because of the water that will enter in it. Plasma proteins complement system. Coagulation. We've talked about plasma proteins in that other video, the one that I just recorded. Endothelial cells, I mentioned them. Vascular smooth muscle, I mentioned. Extracellular matrix, I mentioned. In the extracellular matrix, that's where the infection agent is. And that after the diabetes or transmigration, the cells will move into the extracellular matrix. So structure, fibrous proteins, addition, glycoproteins. Remember what we talked about? I said like there are things that make them attach to the endothelium. And it can be glycoproteins, they can be protoglycans, and different stuffs. Mast cells, fibroblasts, macrophages. I talked about macrophages using leukotrienes, prostaglandins, and other mediators. So those all those are components of inflammation. This summarizes everything. So you've got fibroblasts in the extracellular matrix, you've got mast cells. So you've seen guys. So you've got macrophage and the mast cells outside the blood vessel. So these ones, like I said, these ones are the ones that will release the leukotrienes. Leukotrienes, the ones that can cause the vasodilatation. When vasodilatation occurs, we said it means that there will be increase in the blood flow. When that happens, there is stasis. We mentioned all sorts of stuffs. So you people need to understand that if you had gotten everything that I mentioned last time in that lecture, it means that this lecture is because we're just summarizing on whatever we talked about. So those are this diagram is talking about the components of inflammation. Straightforward. So we've got what about series of a typical inflammatory response. So there are 6, should be 5 or 6, 5R. The series of the steps. So what happens that there will be recognition. That's the first thing. After what does it mean when they say recognition? It means that they will know that there is an infection somewhere, there is a bacteria somewhere. That is recognition. And then recruitment. This is what I talked about. Remember, we had few cells attacking that same very bacteria. Those cells are just there. They are sentinels, the ones that are attacking it. But they need power. They need manpower from other cells. So they will be like, no, let's recruit others. And that is called recruitment. The recruitment, the cells that they recruit will come from the blood vessel, and then they will undergo the same 5 cellular events, and also chemotaxis, the last one, which will make them reach that particular injury. I mean, that will make them to reach where the injurious agent is. From there, those cells will go there so that they can remove the cause. When that happens, you regulate. There is regulation. Remember, anything that happens in the body is supposed to be regulated. It can't just be happening like that, because if it continues, it can start attacking our body cells, and that is called autoimmune infection. Okay. So recruitment of leukocytes. You've seen what I talked about. So what are the functions of macrophage? Number one, elimination of microbes. That is immunology. And we discussed that. So this thing that is here. It's one that is summarized in vascular responses or vascular response. Yeah. Number one, there is vasodilatation and increased vascular permeability, which will lead to stasis, and it can also lead to edema. I mentioned all these stuffs. So if you didn't get me properly, you can go to the video of the recorded it. I'm going to send it in our Telegram group soon. So after regulation, you repair. You repair the damage. Make sure they are done with their job. If they want, they can even go back to the blood vessel. So now, how do they recognize the microbe? Remember, in immunology, we said they have got pumps and dumps. They have got what we call pattern recognition receptors on many cells. So pattern recognition receptors, these ones they recognize pattern recognition receptors. On many cells, recognize and engage pattern and damage. So we've got pattern and damage as well as molecular patterns. These ones, the damage. We said where are they? Where can you find them? I think I've forgotten, but you can look for them. You can look for them, the pumps and the dam. The pattern associated molecular pattern. Okay, it's here. So we've got the pattern recognition receptors. These ones they are recognized, meaning that they are in our blood, in our cells. So these ones are located in all cellular components such as the plasma, endothermal vesicles. These ones are present in our cells. Okay. So and these are the good examples of them. We've got pumps. So pumps are pattern associated molecular patterns. So pump are pattern associated molecular patterns. Okay. So those ones are present on the microbial agents, the virus, bacteria. Okay, these are not that important. So the recognition of molecules and damaged cells. How do they recognize? That's what they're trying to talk about. Types of inflammation. We've got acute and chronic inflammation. Please know the differences between the two. So we've got acute and chronic. Okay. These are the features. How do we differentiate them? This one is also a potential question. So feature, acute and chronic, these are two types of inflammation. The feature duration. So acute, from the word acute, means that it is not taking long. So it's fast, minutes or days. While the chronic, it can even take years, the chronic one, and it's very slow. When they say that the disease is chronic, it means that it takes a little time in developing or in pathogenic activity or in pathogenesis. For it to develop, it takes too much time, and that itself, that itself gives itself or that particular definition, or that being said, describe why people have been chronic inflammation, they will stay longer than the people who have an acute, because an acute can even kill right now, because that one is fast. So fast, minutes or slow. How about the cellular infiltrate? Which cells are there in the acute and the chronic? So in the acute, we've got what we call neutrophils, mainly neutrophils. And remember what we said, we've got neutrophils, which are part of the white blood cells. Where are white blood cells coming from? From the suspended elements. And we said among the white blood cells, the one that is common is neutrophil. The ones that are common are neutrophils. So if they are the ones that are common, meaning that whenever there's an infection, these ones are the ones that will be there because they are a lot in their blood. They will be the first ones to reach the tissue. So they are called. They are the ones that will. These ones they can help you to do the diagnosis. You should check the blood count, and then you find that you have a lot of neutrophils in a short period of time after there was infection or anything, and that is, you can actually diagnose and say, no, this is acute inflammation and not chronic inflammation because of that same very property. They are a lot and they reach that tissue fast. Therefore, they are there in the acute. They are present in the acute inflammation. Wow, these ones, the monocyte, macrophages, and lymphocytes, these ones, they will take long, like I said. And there are a few, the monocytes in the blood. So for them to just reach that tissue, developing and everything, they take time. How about tissue injury? These ones, the acute is mild and self-limited. Wow, these ones, the chronic, remember what we said, it's often severe because it will take long. So it's often severe as it is taking long, meaning that it is progressing. It is progressing, meaning it is progressing. So often severe and progressive. Wow, this one is usually mild and self-limited. So it will be limited to somewhere. How about local and systemic sign? So acute, like I said, this one is more like an onset. It's a fast one. So these ones will give you a lot of symptoms, and the symptoms will be localized and systemic symptoms. If they say systemic, meaning that they're talking about the systemic signs. For example, the blood vessel, how is the blood flow? BP, how is the what's this, the BMI, the basal metabolic rate. How is the body mass index? What is happening systemically and not locally? So this one is in acute is prominent because it occurs fast. While this, because the disease is developing at a slow pace, it means that you'll be having problems in seeing or seeing the what's this, the local and systemic signs in the chronic inflammation. I don't know if that is making sense, but I cannot explain more than that. Yeah. Acute inflammation, definition, components, cardinal signs of inflammation, vascular changes, response of lymphatics and lymph nodes, cellular changes. We talked about those. So acute inflammation, a response of vascular tissue to injury. A response of vascular tissue to injury. So acute inflammation recruits neutrophils during test one. This is not actually important, but you can know it recruits monocytes, macrophages after 3 days. But neutrophils, like we said, these are the ones that are common in acute inflammation. Delivers plasma proteins, antibodies, complement, and others. Okay. Purpose to neutralize and clear the cause of the injury or the noxious agent, to remove the necrotic debris. This is not pronounced debris, it's debris. The S is silent, so it's debris. So to remove that is why in the definition first, if you check, I mentioned something like debris. Okay. Two main components of acute inflammation. I explained this: vascular changes, vascularization, increased vascular permeability, stasis. Several events, we've got emigration from the small vessels, accumulation at target sites. So immigration, we've talked about the movement of cells from the blood vessels and go to where the site is, the infection agent is. So the process is orchestrated by these of chemical mediators. So it is helped, or it can be done, or it is done by the help of mediators, the chemical mediators. So now you need to know the 5 cardinals of inflammation. And I can tell you what is happening and what is bringing the same cardinal, what's the signs, the 5 cardinals of inflammation. Now we've got each. So what is bringing it is because there is vasodilatation, there is an increase in the diameter. Therefore, there is a lot of blood that is going there. So if you are going to have a lot of blood there, a lot of blood, meaning that will cause the itch, it will cause a itch. So you're going to have increase in the blood flow. Since there is increase in the blood flow, that will cause itch. So lateness because the blood is going there. A lot of blood is going there, so that will cause lateness. Swelling, which is tumor. So these are Latin words. Greek, I don't know if they're Greek or Latin, color, itch, rubor, redness, tumor, swelling. So they swell. They form like something like an abscess. They swell like edema, the way the edema look like. Yeah. So they swell, that is swelling. Dollar, which is pain. There is pain because there are chemical mediators that are there, and the blood vessel has been dilated. So you expect pain to be there. And then there's also loss of function. Loss of function. So that tissue cannot function because it is being inflamed. So those are the 5 cardinals of inflammation, and they can ask you itch, redness, swelling, pain, and also function. Vascular changes. Vascular changes, these ones I mentioned, I talked about them. Okay, I talked about this. Rate of loss of proteins, I mentioned this. My imagination of leukocyte, I talked about them. Remember, they are part of vascular changes, and I said I'm not going to talk about them again. You see what I talked about? I said the endothelium here, which is the epithelium of the vasculature of the blood vessel. When it gets injured, like I said, it will vasodilate here. You've seen what is happening. Everything that I mentioned there has been highlighted now. The protons can start moving from the inside to the outside. That is what I said. If there are cells that are moving there, the cells are that process is called diapedesis or transmigration. That is what I said. So I mentioned everything about this. Fluid movement. So now this one you are going to understand, you are going to feel it next tomorrow when we talk about we talked about this. If you check properly through the notes, I think you have notes, you can read through the notes, it will make sense. But I've explained everything in a simpler manner. Go to the first video that I sent, I'm going to send, sorry. Go read, watch it nicely and understand it. You are going to write a good essay. It's not about you just reading the notes, it's about understanding the concepts. So even if they complicate a question, they trick it, they make it tricky, you get it. You're able to get it, understand it. If they can bring the question in the other way around, you're able to explain it, because I have a lot of questions and I'm going to present the questions to you tomorrow. I'll come with a book. Okay. So how does inflammation lead to vascular leakage? So contraction of endothelial cells, reversible. Dread, prolonged leakage, mild injury, late response, endothelial cell retraction, reversible changes. Okay, this is not also important. If I don't talk about them, they're not important. As long as you've understood everything that I talked about, the cellular events and the endothelial injury. So how does it lead to vascular events? Number one, we talked about in the contraction of the endothelial injury. Two, endothelial cell retraction, meaning that these cells do not get back together because they have been retracted. Remember what we said? Because we said between the two endothelial cells, that's why that's why the cells will close. So that will retract. It will cause it will disrupt that integrity. How inflammation leads to vascular leakage? How does it lead to that? Direct endothelial injury. So causing endothelial cell, okay. This one also you're also going to get it tomorrow when we talk about the hemodynamic disorders. So delayed prolonged response, leukocyte dependent endothelial injury. Okay. So edema in inflammation. Like I said, there will be edema because the permeability has been increased. Therefore, the blood will start moving from the inside to the outside, and that will cause to edema. That will cause edema, and this is edema that they are showing there. Edema and inflammation. So there is transdate and exdate. So you just have to know the differences between the transdate and the exdate mechanism. So this one we'll talk about it. We'll talk about it tomorrow. We'll talk about it tomorrow. We'll talk about it, I think, tomorrow when we're talking about hemodynamic disorder. So what is the response of lymphatic vessels and lymph nodes? Lymph nodes, remember we said these ones are part of the immune system, and therefore the most important thing to understand is that they what's this, like the spleen, we said it filters the blood. Remember what we talked about last time? So this is immunology as well, we can talk about it tomorrow. Cellular events, don't forget. For now, your take home is to go and read through the cellular events and the cellular events, vascular events, inflammation definition, which is in the first video. You can write it down, and then also know the difference between the chronic and acute inflammation and 5 cardinal signs of inflammation, and also the recruitment, recognition, those things, just those things. If you understand them properly, please, yeah, you're home and dry. And tomorrow I'm coming with questions for you. We're going to answer them. From there, we want to discuss the hemodynamic disorders tomorrow at 10 hours. Please, let's make sure that we come on time. 10 hours we start, 12 hours we stop, because we have a lot of things to do, all of us. So tomorrow, 10 hours, let's meet. Thank you so much for your time and attention. I appreciate you a lot. I'm sending you the video. Have a good night. Okay.